Hello everyone, this is Dr. Saroj Siddhapi from the platform of UKMLA with DSS, and let's just continue our success course of the UKMLA 2 exam. In today's lecture, what we are going to discuss is the structure and the approach that you need to have for the dermatology stations. And dermatology stations are like commonly tested in the exam. It's very likely that you're going to see and you're going to encounter a derma station, okay, and it may be a dermatological complaint in the adult group, or it may just be a dermatological issue in the pediatric group, okay. So in both of the cases, the basics of the derma history would be the same, but there would be just slight variation. And I'm going to talk about the variation that you need to have in your mind when you're dealing with the derma case in a peds group, okay. But let's just discuss what the basics of dermatology is and what's the basics of history taking whenever you encounter a derma case, okay. So yeah, this is for the adult group. This person is 45 years of age and he is presenting to you with a rash, okay. So the presenting complaint would either be a rash or it would be a lesion, um, or it may be, the patient may present with itching, or something weird that the patient may have noted on the skin, okay. So you would automatically know, and it would be pretty straightforward and very well understood that this is a derma case, okay. So the first thing that you need to do, the very first layer in when it comes to a derma station, is basically exploring the rash itself, okay. And there are two aspects to exploring the rash. Number one is its morphology, okay, the morphology of the rash, and number two, its associated symptoms. Okay, just like the way we did anything else in the in the medical history and in other histories that we discussed, anything else in the associated symptoms. So the associated symptoms, is also present over here. Okay, so there is no Socrates, there is no Odipara, but there are specific questions that you need to ask when it comes to exploring the morphology, okay. In a couple of previous sections I told you that, okay, if you've got a bunch of questions, if you've got 10, 12 different questions, it would be okay to just touch upon the aspects briefly, and it would be just okay to ask 5 to 6 different questions, and out of the 12, and you'll be fine. But in this case, okay, the morphology needs to be explored in detail, okay, and you need to ask each and every question that is mentioned in this particular layer, whether it's the morphology or it's the associated symptoms. Even the layers that are coming forward in the dermatology structure, you need to make sure that you are asking each and every question, because each and every question is very important, okay. So we're not just touching on the aspects, okay, we're actually trying to explore something, and we're actually trying to go into the detail of something, okay. So the morphology, the first question that you're going to ask, that, okay, can you please tell me more about the rash, okay. So it may be possible that in the operator question they may just answer some of the questions of the morphology, but if they don't, then you should be aware that you should be asking, number one, can you please tell me where exactly the rash is. Okay, so they're going to say that, okay, it's on my leg, it's on my arm, it's on the back of my neck, okay, it's on my chest, okay, wherever the rash is, okay. So that is the site. Number one. Number two, you're going to say that, can you please describe the shape of the rash for me? Yeah, doctor, I've got circular lesions. Yeah, doctor, I've got triangular lesions. Yeah, doctor, it do not have a particular shape. It's just present there on my arm everywhere. Okay, so they're going to describe the shape for you. All right. Then can you please describe me how the rash looks? What is the color of the rash? Yeah, doctor, it's a red colored rash. Yeah, doctor, it's a pink colored rash. Yeah, doctor, it's a purple colored rash, or it's a black colored rash. Okay, so it's going to tell you something about the rash. Okay, like if it's a purple colored rash, you may think about psoriasis. If it's a pinkish rash, then it can be anything, but you may think about allergic rashes. Okay, if it's a black colored thing or a dark colored thing, okay, you may think about the cancerous pathologies of dermatology that are commonly present, okay. So the color of the rash is important. Then you have to ask about the number, okay. And how would you ask about the number? This is a bit different. So you're going to say that, okay, can you please tell me, is the rash countable or is it uncountable? So if it's countable, like let's suppose if just a lesion or just a mole or maybe just a patch of squamous cell carcinoma, it would be pretty much countable, and they're going to say, yeah, doctor, it's countable. It's just one particular lesion that is there on my arm. Or if it's let's say if it's still countable but not one, they're going to say, yeah doctor, I've got a couple of lesions like these on my arm and on my forearm, and also on my on the back of my hand as well. So they're going to describe it for you, all right. But if it's a widespread rash, let's suppose it's a rash of the chicken pox, you cannot count the rash, okay. They're just going to say that doctor, it's a widespread rash that is present all over my trunk, all over my chest, okay. If it's a psoriasis, okay, they're not going to count it. It's not practically possible to count the number of rashes that are present in the psoriasis case. They're just going to say that doctor, no, it's just present all over my legs, okay. So it's very important that you inquire about the number, that is it countable or is it uncountable, okay. This was the fourth question. Now the fifth question is asking about the borders, okay. And how you're going to ask about the borders, you're going to say that, can you please have a look at your rash and can you please tell me, is your rash is on the same level as your skin, okay, or is it something that is above your skin level, or is it something that is protruding out from your skin, okay. So you would understand that if the rash has the borders within the skin layer, or is it above the epidermis, okay. So you need to understand the morphology as well. Like for example, cellulitis, uh, it would be within the skin, okay. It would not be something that would be protruding out. But for example, a mole will have well demarcated borders that are protruding above the skin level, okay. So all of these questions may be telling you something or the other about the rash that the patient is having, all right. So these five questions are like very very important when it comes to exploring the morphology, okay. Remember them and make sure that you ask them every time, all right. Then you move on to the associated symptoms, okay, or also known as the red flags, that may be present in a rash, okay. So the associated symptoms are: number one, itching. By any chance, does it itch? If it's just a mole, it wouldn't itch, okay. If it's an allergic reaction, or if it's an atopic dermatitis, it is going to itch, okay. Then is by any chance is it bleeding, okay. If the rashes are bleeding, that means it's a dangerous sign, it may be cancerous, all right. Are there any lacerations present, okay. Do you have any discharge coming from those rashes, okay. And by any chance, are you running any fever, okay. So five associated symptoms, they should be more than enough to give you a idea and give you a much holistic approach towards the morphology of the rash and exploring the rash and its associated symptoms, all right. So these 10 questions are like really really important in the beginning, okay. I hope that I've covered the first layer in a lot of detail for you. Sorry about that. All right, now it's time to move on to the second layer, that is exploring the red flags that are present whenever it comes to the derma stations, okay. Now the very very first red flag is, by any chance does your rash or does your lesion change in size, okay. By any chance does it change in number, okay. How much is your sun exposure? Do you keep your skin exposed to the sun for most of the time, okay. By any chance, do you use cosmetics? How frequently do you use them? Do you apply cosmetics all of the time, okay. So these four questions, and what are these four questions indicating? These four questions are indicating a very strong possibility of a carcinoma, okay. It can be a squamous cell carcinoma, most likely, okay, or it can be any different cancerous lesion uh, that the patient may have, okay, when it comes to dermatology. So these exploring these red flags is like really really important. Any change in size, any change in number, how much is your sun exposure? Somebody may come to you and they may be a construction worker, and they're going to say that doctor, most of the time I'm working outdoors, they're exposed to the sun. Somebody may come to you with excessive use of cosmetics, they may be in the fashion industry, okay, and they say that doctor, I keep on applying different products to my skin, it increases the risk factor for skin cancers, okay. So you need to explore these red flags in detail, okay. Now in the dermatology station, you don't have to actually examine, but you need to verbalize something that okay, I would like to have a look at your rash. Okay, so now I've written it there. Ask for the picture of the lesion. Okay, so you don't actually have to say that. Can you please show me the picture of the lesion? What you're going to verbalize is that okay. Can you please show me your rash? Can I please have a look at your rash? Okay, so this is something a bit different. Typically we have to wait till the very end to ask about the examination and inspect the patient for any signs, but it's always better to get the idea and have a look at the rash at this stage. Okay, so after you're done with the first two layers, then ask about ask and request to basically have a look at the rash. And when you say that, what they're going to do is that the examiner or the simulator, they may just hand over you a picture of the rash. Okay, and this is where things get tricky, because dermatology is something that can be like particularly difficult to diagnose, okay, on the basis of the history, and it's kind of difficult to diagnose when it comes to the visuals as well. And something called the spot diagnosis works in dermatology most of the time, but even just having a look at the rash may confuse you. Okay, so I'll just share a couple of pictures, okay. But you would have to, go through the notes, search the internet, okay, and try to make sure that you have seen different pictures of a particular lesion. Like let's suppose if it's an eczema, then you need to make sure that you have seen multiple pictures of eczema online, okay. Very important. And there's another website, I'm not really sure about of its name. It's called derm.net. A lot of pictures are also available there as well, but just google it, okay, just google it and see as many pictures of different diseases as you can. I'll try to zoom it for you, so that you can just have a look and maybe just take some screenshots if you want to. But these are not the exam pictures, okay. Do not expect to have the same pictures in the exam, okay. In the exam things may be very different, okay. And you may get surprised as well. All right, so do not just rely on uh, these pictures for your exam purpose. All right. Okay, so yeah, so I hope that you have seen the pictures and you have got the basic idea about when to ask about the picture. Okay, so yeah, all right. Okay, so now comes the third layer. Okay, the next layer that is very important is the floss sign. Okay, we have already done the floss sign, okay, in a lot of detail, so you already know that what floss is. Okay, so you have to do the flaw, because if it's a cancerous condition, okay, the patient may have lumps and bumps, may have weight loss. The patient, if it's an infectious pathology, the patient may be uh, having fever as well. Okay, and then after you're done with the third layer, comes the fourth layer. Okay, so I have mentioned it as p slash bind slash maftosa. Okay, and why have I like written it down like this? Because p stands for the past medical illness. Okay, it needs to be asked nevertheless. Okay, but let's say if it's a pediatric case, then you gotta do the bind, that is the birth, immunization, nutrition and development and dehydration. Okay, and then if it's a pediatric case, you're going to do MAF only. All right, and if it's a full adult case, then you're going to do the MAF TOSA and the entire meftosa. Okay, so it depends. If it's a pediatric case, you're just going to go with the P bind and the MAF, and if it's an adult case, you're going to do the complete meftosa. All right, but what is more important in this, uh, in the meftosa aspect and the P bind aspect, is there any recent travel? Because lot of skin condition may occur because of travel, like for example scabies. Okay, somebody who has recently traveled may develop scabies. Okay, somebody who might have gone for a camping trip may develop a rash of the Lyme disease. Okay, so you gotta make sure that you're asking about the travel history. Okay, and then asking the pediatric group that are they up to date with their jabs, if their immunization is complete, because you want to rule out the possibilities of infectious rashes. Okay, so make sure that you ask these two questions when you're covering the P bind aspect and the meftosa, depending on if you're covering the pediatric group or if you're covering the adult group. Okay, so yeah, very important layer. Okay, just a couple of questions, but make sure that you just ask it because it may be relevant. Now the last aspect, okay, it's very important, the psychosocial aspect, and why I have mentioned it separately in the end, because this is the layer that if you're missing out on this, then you may be compromising on a lot of your marks. Okay, your IPS may get affected, your data gathering may get affected. Okay, and so does your management. Okay, so it's very important, and I'm going to tell you why. What are the questions that you need to ask when it comes to the psychosocial aspect in a dermatology case? The impact on day to day life. Okay, are you able to sleep properly? Are you able to go to work? Why? Because just imagine somebody is having a rash on the skin. Okay, somebody may be having a rash on the face. It may be very embarrassing for them to go out in public. Okay, they may not be able to work because of that. Number one. Number two, sleep. Their sleep may get affected because of the itching. Like, let's suppose if somebody is having eczema or atopic dermatitis, they would be itching badly. Okay, and because of it, scabies specifically, the nighttime itches. Scabies patient, like, their mental health get affected because of the itch, and the itch is so severe. Okay, so you have to ask about the impact on day to day life, specifically the sleep and the work. Okay, so since you're asking a question, it's a data gathering. Since you're thinking about the patient that okay, his or her sleep may be disturbed because of this dermatology condition, or they may not be able to face the public, they may not be able to go to the work. It shows your IPS skill as well. Okay, and you may have to suggest some solutions for their work, or maybe for their better sleep quality in the management part. Okay, so it's also related to the management as well. Okay, so make sure that you are asking this aspect. Make sure that in the end, after you're done with the flaws and the P bind or the meftosa, you ask about the psychosocial aspect, that impact on day-to-day life, sleep and work. What do you do for a living? What kind of work do you do? Okay, important aspect. One last question that is very important. Okay, any recent contact with a person having a similar rash? Okay, this is like really important, because a lot of these derma condition, lot of these skin rashes, they are contagious. Okay, chicken pox, if your child had a recent exposure with someone having a rash similar to chickenpox, between that infectivity period, which I'm going to talk about later on, they may also develop chickenpox. Okay, mumps is something, measles. All of these are like really contagious diseases. Scabies. Okay, somebody having scabies, burrow-like region between the fingers. They go and they shake the hand, and then eventually they also end up contacting scabies. So you gotta do the contact tracing as well. Okay, so this question becomes like particularly important and like really important. Okay, all right. So yeah, this is basically the structure that you need to follow when you're dealing with the derma cases. Okay, just quickly review it for you: morphology, site, shape, color, number, border, associated symptoms like itching, bleeding, laceration, discharge, fever. Then red flags like changes in size, number, any sun exposure, use of cosmetics. And then you're going to ask about the picture of the rash, or you're going to say that okay, can I please have a look at your rash? And then once you're done with that, you're going to do the flaws. You're going to do the P bind meftosa. Okay, P bind if it's a pediatric case, and the entire meftosa if it's a adult case, and specifically ask about the travel history and the vaccination status of a pediatric of a patient of a pediatric group. Okay, and then the psychosocial aspect, what it is, why it is important to ask, and also make sure that you do the contact tracing as well. All right, so this is what the dermatology structure is. Okay, but before I move on, I just show you an example, and like I'll tell you what the variation you need to do. if a dermatology station comes to you with a pediatric group. Okay, so very simple. You're just going to take the derma history first. Okay, dermatology morphology history. The morphology history is the first layer. This one. Okay, exploring the morphology and associated symptoms as well. Okay, also ask about the associated symptoms when it comes to the morphology. Okay, and then you try to rule out the red flags in derma. Okay, these are the red flags in derma that you're going to ask. So the first two layer doesn't change. Okay, then you ask for the picture of the lesion, even that doesn't change. Okay, what changes is that you directly move on to the P bind and the MAF. Okay, so you just skip this layer. Okay, I'll just highlight it in green for you so that you know that it needs to be skipped. So you're just gonna skip this layer, directly move on to P bind and MAF. Okay, I'm gonna highlight it for in blue. Okay, skip this layer, just do the P bind and MAF, and psychosocial aspect needs to be asked nevertheless. Okay, and this is the variation that you need to do. Okay, so if you're like not asking the P bind, if you're not taking the pediatric specific history, then even though you take a flawless derma history, your marks would be dedicated and you would not be scoring high in your exam. Okay, so yeah, one more thing you need to remember the infectivity period. Okay, and it's very important because most of the concerns would be when you're done with history taking and when you're done with uh, coming to the diagnosis and when you're doing the IRMAS and the or the REMAS when it comes to the management, they will show you some concern. They will throw you some concerns. Okay, and one of the concerns would be that, okay, doctor, when can since how long I have to keep my child in isolation. Okay, so these are the diseases in which you have to keep your child or keep the patient in isolation and make sure that you take the contact precautions. Okay, and specifically like scabies until the patient is symptom free. Okay, until the symptoms are there, contact precaution needs to be taken. Chicken pox infectivity period is 2 days before and 5 days after the rash. Okay, measles 4 days after the onset of rash, impetigo 2 days after the onset of rash, eczema 2 days after the onset of rash, and ringworm until the rash disappears. Okay, so if somebody is getting exposed during this particular time, it's likely that they're going to catch the symptom and they're also going to catch the rash that the patient may be having. Okay, so one concern. Other than this, they may be dropping some more concerns. Like for example, they're going to say that, doctor, I have a pregnant woman at my home, or doctor, I have someone elderly at my home who is usually sick and who is usually ill. Okay, so since how long I should be staying away from them. So you should know about this infectivity period so that you can answer this question. Okay, very important. Number two, what I would like to tell you is that for the management of dermatology cases, it's the IRMAS protocol. Okay, you need to explain the diagnosis. You need to take the vital and examination, and then move to the investigations. The investigations are most of the time like quite simple, just the simple baseline investigations. Okay, but in the cases when you're suspecting cancers, you may have to offer a biopsy. And when it comes to the referral is mostly to dermatology. Okay, and it's a routine referral in most of the cases. But if it's cancer, basal cell carcinoma or squamous cell carcinoma of the skin, then the referral may be a 2 week wait pathway. Okay, or urgent 2 week pathway, or the cancer referral pathway. All right. Apart from this, the medical management, okay, it varies from case to case. Okay, the advices, okay, the advices are like really important in the dermatology sessions. You need to make sure that you advise about the contact precautions, you advise about reducing sun exposure, you advise about changing the pillows, you advise about maintaining hygiene, you advise about taking off from work wherever it is relevant. Okay, and then you advise about staying away from immunocompromised uh, patients, okay, in case of, like, for example, chicken pox, in case of, the disease which are like transmitted rapidly, or staying away from the pregnant women as well, okay. So, like, it's a very, very important piece of advices that you need to give. And then in the safety netting, you can just talk about itching, extreme itching, bleeding, discharge, any change in shape, any change in size, okay. So you're going to do all of these things, all right. This is the second thing that I wanted to teach. The third very important thing about dermatology session that I want to mention is a lot of times, there would be just a harmless mole on a patient, okay, or the patient may just have a very harmless lipoma that might be, disturbing the patient, and the patient will come to you and addressing that, they're getting married and they have a mole right over here, okay, and they just want to get it removed, all right. So if it's just a harmless mole or just a lipoma, okay, or just a harmless skin lesion, do not make the mistake of referring the patient to the NHS dermatology clinic, okay, because the NHS does not cover and does not fund the removal of moles, okay, unless it's increasing in size, unless it's increasing in number, unless it starts bleeding, okay, or unless it start showing some laceration or some discharge, okay. If it's just a harmless mole that has been present there for a very, very long time, it's not causing any apparent distress to the patient or mental health issues to the patient, the NHS does not fund the removal of moles or lipomas, okay, unless there is a medical indication to it. And I told you the medical indications: extreme itching, effect on the quality of life, bleeding, changing in size, changing in shape, changing in number, increasing in number. Okay, all of these things, are medical condition, or if the patient's mental health is, severely affected because of it, then only the NHS would, offer the removal or the laser removal, or the cauterization of the mole through the NHS services, okay, through the free welfare NHS services, okay. But if somebody is just, getting married, if somebody, has an event to attend and they don't, like the mole on their face, nobody likes a mole, or nobody likes, something, addition on their skin, and if they just don't, like it for the sake of not liking it, then NHS is not going to fund, okay. So do not end up referring the patient to the dermatology clinic of NHS. Counsel them that, okay, what you can do is that you can go and visit a private dermatology or aesthetic clinic, okay, and they may remove it for you for a cost, all right. Do not make a referral to private clinic, okay. You're, as an NHS doctor, you're not there to, make a referral to private clinic, okay. What you can do is that you can just suggest, okay, just counsel them that this is something harmless, this is not going to affect you, this is not going to be fatal, this is not going to, harm you in any ways. But if you still want it removed, then what I can suggest to you, not that I'm referring you, okay, what I can suggest to you is that go to a private dermatology clinic, or a private aesthetic clinic, or a private skin clinic, okay, and they're going to remove it for you, but they may take some certain cost, and then they're going to say, doctor, no, I pay my funds and I pay my taxes, I want to, get it done from the NHS. And then you're going to say, I'm really sorry, but NHS doesn't have a policy like this, and we cannot remove it until it's there is a medical indication or a psychosocial indication towards it, okay. So you just have to, politely say no to them, and give them the option of going private, okay. So these were the couple of things that I wanted to talk about the dermatology, okay. And when you read the cases, there are many cases of dermatology. Like, I think there would be 40-45 cases, I think. If not 40-45, but at least 40 cases would be there of dermatology. They keep on adding new cases of dermatology, okay, because they know it's a difficult to diagnose, it's a difficult to, pick up by just looking at an image, okay. So make sure that, you have gone through all of those cases, okay. And if you've got any queries and any confusions regarding it, then drop them down in the comment box. Reach out to my socials. I'm going to address all your concerns. And if you want a one-on-one mock with me, sign up by scanning the QR code, and I'll be happy to help you. See you in the next lecture.